Restylane versus Juvederm for lip augmentation. I've used Restylane and Juvederm for lip augmentation one time each, 9 months apart. My first time was with Restylane. The doctor used 1 cc. I could leave the house after the weekend. The second time, half a cc of Juvederm was used, and my lips exploded. That doctor went through the border of the lip or behind to inject. Do some people have a different reaction to Juvederm since it pulls more water to the location? Are the particles in Juvederm thicker, or do they spread out more? Both physicians are highly qualified.
Thank you for your question. You described in your question an experience where you had Restylane placed at one point for your lips where 1 cc was used and you had a limited amount of swelling, and that at another point you had Juvederm 1/2 cc and your lips swelled significantly. And so you're looking for an explanation and understanding. Well, I can certainly assist you with this question. I'm a board-certified cosmetic surgeon practicing in Manhattan and Long Island for over 20 years. I'm also a member of the Y-Lift network and use Juvederm a lot in areas of the face for volume improvement, or something we call structural volumizing, to create like a facelift effect. And I've been using Restylane since the beginning when it was first FDA approved. So certainly I've had a lot of experience with both, and I can give you a certain perspective on how I deal with patients whenever we have such a similar type of situation. First of all, it's very important to understand that the reactions can be individual, where one patient can have a tremendous amount of swelling with one product, and we'll do a skin test and we'll try to figure out if there's an allergy, try an alternative product, and have considerably less swelling. But it's worked both ways. We've seen swelling from Juvederm, we've seen swelling from Restylane, and it's me being the same injector doing the same technique. So it's my personal bias that for finer work along the border of the lips, I tend to prefer Restylane. I think that whenever we have any kind of discussion about optimal fillers, we always get into this type of heated debate about how it works in such and such's hands. But I think it's more that it's also about the individual patient. So in terms of the swelling afterwards, it is probably something that your doctor is familiar with and was able to assist you with in navigating through the swelling. We have to distinguish between just reactive swelling from volume, or actually should say from the trauma of the treatment, versus the swelling that's the result of the hydrophilic, or the swelling from the water. And then how long did that take to resolve? I always tell my patients that you can expect a certain amount of swelling, and we try to mitigate that during the procedure through a variety of methods. But then at the same time, there's at least a couple of weeks of letting it settle in. And so we routinely see our patients in about 2 weeks to make sure that the contour and shape that we saw when I did the procedure is maintained. And sometimes there's a need for enhancement. Sometimes we have to add a little bit more. So with that being said, I think from your experience, you may want to choose to just use the Restylane moving forward. And sometimes people want to switch from one product to another for the sake of longevity. But it has been my experience, again, for doing hyaluronic acid fillers since Restylane hit the market several years ago, I believe it was around 2005, that it is still something that you want to customize individually, because some people, the product will last a lot longer than what the manufacturer of the product will state based on their FDA studies, where they did studies to show the FDA what their results were, and that's what they write on their information. But for people in practice, I've had patients who I did Restylane for in their lips, and it effectively lasted over a year. So it's not just an absolute. There is a lot of factors in what happens to the individual in terms of metabolization of the material. So it may be for you a better choice to just do the Restylane moving forward if you want to avoid this, or do at least some skin testing or something to try to balance out what could potentially be a swelling effect if you want to try Juvederm again. In my practice, I would probably advise you against it. I would say just use something that is consistent, because these are supposed to be like lunchtime procedures, and we're supposed to be able to get people back to their normal day quickly. And so that being said, I think you have to make practical decisions, even if it means that a material like Restylane may not last as long in you, but at least you can avoid the undesirable side effect of swelling disproportionate to what you would typically expect. So I hope that was helpful. I wish you the best of luck, and thank you for your question.